Hi, I'm Dr. Anne Marie, and welcome to this special edition of Ask the Experts. Today, we're focusing on your feet. Think about it, your feet are the foundation of your overall health. We are very fortunate to have world-renowned foot surgeons Dr. Michael E. Graham and Dr. T.J. Ahn in the studio with us today to take an in-depth look at some of the most common foot problems impacting not only adults, but our children as well. Hello everyone, I'm Dr. Anna Marie. Today we're discussing a medical breakthrough to treat misaligned and flat feet. We'd like to welcome a world-renowned foot and ankle expert to the show to talk about this revolutionary orthopedic solution. Dr. Michael E. Graham, thank you so much for joining us. What an honor to have you here.
It's my pleasure. Thank you so much.
Before we get to the procedure, let's back up a little bit and talk about misaligned feet and how this could open a whole can of worms when it comes to the overall health of somebody's body.
Exactly. You know, our feet are the most neglected and abused part of our body. We put our shoes and socks on and forget about them. But misaligned feet, starting in young children, will only get worse as we get older because walking is the second most common conscious function of our body. We take thousands of steps a day. So we worry about the alignment of our buildings and of our cars. But when it comes to our body, which is so important, we just shrug it off. And so basically what happens is that the ankle bone loses its normal stability, and that's what causes misaligned feet. And then that sends off a negative chain reactions to affect the knees, hips, and back.
You know, there's been studies out there that basically that in a sense of even like getting back to the children, when they see their doctors, they'll just say, oh, they'll eventually grow out of it. I mean, what are your thoughts in regards to that advice?
Exactly. I mean, the whole thing is that there's no evidence for that. You know, there was a paper that came out that basically looked at the fat pad of the inner arch, and it's true that babies have kind of fatty feet, but you're not supposed to have a flat foot. And so there's no evidence anywhere that how these kids, you know, how the bones that were misaligned all of a sudden become aligned. And what's even worse is all the other medical problems that can happen because of those misaligned feet. And pediatric obesity is such a big problem, and even adult obesity is a problem. And you know, the number one recommendation is just to simply go out and walk and exercise. But when you're punished for doing that with pain to all over, you're not going to exercise. So then what happens is your metabolism decreases, you gain weight, and then the more weight you have, then you have all these other medical problems, like of course obesity, but then diabetes, hypertension, and heart disease. And it seems like, you know, nobody's ever cured of these other diseases. We just kind of treat those symptoms with pills and medicines and things like that. And you know, again, we want to get people out walking and exercising. That's kind of like the big missing piece to the puzzle.
You know, this is a topic very near and dear to my heart because I'm a podiatrist, and the fact of the matter is it really amazes me that a lot of people are just kind of like, oh my gosh, I feel so much better, my knees are better, my hips are better, my back feels better when you get that foot supportive.
Exactly. Right. Definitely.
So tell us about this procedure. Obviously, you know, you're the brains behind the invention.
Right.
Could you simply explain to folks how it works?
Yeah, okay, so again, the whole thing that we're trying to fix is really one thing, and that is to restore the ankle bone alignment and stability. And throughout the history of orthopedics, there's been, you know, all these different methods that are tried, and it seems like you have the bullseye, you know, with the center of the target is like really what we need to fix, and everybody else is just kind of treating everything around that. So what I invented was a little stent that we basically insert, well, not basically, we insert it into a naturally occurring space in between the ankle and heel bones. And instantly the ankle bone is realigned and the natural motion is restored.
Sounds so simple.
It is. It's one of the. It is a complex, simple surgery. So
it's 20 minutes long. It's minimally invasive.
Yep.
Who are the ideal candidates for this?
Well, you have to have flexible hind foot misalignment, and so we have great videos here that we show how their feet are aligned and then misaligned. And so when you can stand and basically realign your ankle bone and how your foot and ankle and lower leg are realigned, then that means you're a great candidate for this procedure. Unfortunately, unfortunately, there's so many people that have kind of just been trying all of the various conservative methods, and then their bones are to the point now where they're rigid or semi-flexible, and unfortunately at that time they may not be a candidate for the Hypercure procedure.
And how young of a patient you could be, and how old?
Yeah, so the age limits are usually, 3 years is the bottom, and not that we say that every 3-year-old should have this, but by 3 years of age, the chamber becomes ossified. The oldest patient that I know that has had Hypercure put into their feet is 94 years old. So yeah, and you can even be later, but just as long as they still have that flexible hind foot, you could be a candidate.
I'm sure you have a lot of great testimonies, but one of the stories that really stuck out to me, Dr. Graham, is the woman right here from Florida that literally her doctors were telling her, you're going to have a heart attack, your sugar's out of control. She actually had her feet put back into alignment thanks to your procedure. So listen to her story, because she lost like several hundred pounds.
Absolutely.
Used to go to theme parks at one point, and I was told I couldn't get on a ride because I didn't fit in the seat properly.
Imagine the embarrassment of such an awkward moment. For years, Cindy Paladona struggled with her weight, but it was when she hit 300 pounds when she had a wake-up call. Her doctor warned her that if she didn't start exercising and dieting, she was about to face problems like heart disease and diabetes.
I know that there were a lot of times out there where I'd be out there and I'd be trying to walk and I'd be crying because I was in pain. And I'm like, how am I supposed to do this if I can't even move around?
Ever since Cindy was a teenager, she has battled foot problems. She was told by expert after expert that she had misaligned flat feet. Simply, her ankle bone was not properly aligned with her heel bone. Over the years, her misaligned feet have caused more than just foot pain. It has seriously impacted her knees, hips, and back as well.
The feet is one of the smaller parts of your body, and they're so underestimated because without our feet, we can't do anything. It's like our feet affect everything that we do, top to bottom.
Determined to get her health back on track, Cindy turned to foot specialist Dr. Robert Rosen to see what her treatment options were.
The conservative treatments for this are things like orthotics, which work externally from the outside in. There's also braces for more severe cases of this. From surgical options, there's fusions of joints, which can take a very long time to heal, where a patient has to be non-weight bearing for an extended period of time. There's tendon rebalancing procedures, which the patient is also non-weight bearing for a prolonged period of time.
Cindy took the conservative route and tried custom arch supports. Besides not providing relief, the devices held her back from wearing her favorite fashionable shoes.
Felt like a front because I like to dress up. And when you have to wear sneakers, it changes the way you feel about yourself.
To get Cindy's feet into alignment, Dr. Rosen used the latest innovative device called Hypercure. The FDA-cleared titanium stent is inserted through a small incision into the naturally occurring space in between the ankle and heel bones. The procedure has a 94% success rate and takes only 20 minutes. Right now, Hypercure is being used by leading orthopedic and podiatric surgeons in nearly 60 countries.
With this procedure, I can have my patients be in a walking boot immediately from day one and in sneakers in approximately 3 weeks. That is perfect. Once you get a patient that comes in that previously has tried orthotics, that has tried some of the other treatments, and you treat them with this minimally invasive surgery, when they come in with that big smile, showing you what they can do, telling you that they can do their activity without the pain that they had before, it is extremely gratifying from my point of view.
Since her foot procedure, Cindy has lost over 125 pounds. She's completed 6 marathons, competed in triathlons, and her most memorable run so far has been on the Great Wall of China, all because of this tiny titanium stent.
I'm a completely different person. I've always been happy and energetic and colorful, but having life back in me and being able to be mobile and not be afraid to do anything. I've jumped out of an airplane now, because, I got my weight off and I'm happy and I'm content. It really did change my life.
That's such a great story, wasn't it?
Right. It
And
just touches my heart. Absolutely.
So, I
yeah.
mean, is that one of the best stories? You must have so many of these stories.
So many stories. We have children who are in wheelchairs that couldn't walk because of their pain, and the surgeons put in these stents, and now they're out running. They're gymnasts, and it's really an amazing solution.
Doctor, folks want to learn more about this procedure or find a doctor in their area. I mean, what's a good source for them to turn to?
Well, we have a great website that's called atlasfai.com.
When we come back, we're taking a look at overpronation and flat feet. We'll be right back.
Hi, I'm Dr. Anna Marie. Thanks for joining us. Today we're talking about flat feet and a condition called overpronation. Both can be rather complicated for those suffering from the foot problems. Unfortunately, there are plenty of misconceptions out there. Let's take a close look at overpronation and flat feet to find out exactly what causes these conditions, why they're bad, and what can be done to fix them. We're very fortunate to have two of the leading foot and ankle specialists with us today, Dr. Michael E. Graham and Dr. T.J. Ahn. Doctors, thank you so much for joining us today. Feet, big problems in our country. Tell us about overpronation and flat feet. What causes them?
Yeah, well, thank you so much for inviting us here today. And yeah, overpronation seems to be such a complicated problem, and as far as flat feet too. And one of the big differences is that with flat feet, usually you have that fallen arch, but what causes that arch to fall stems back from the hind foot and the alignment of the ankle bone. So when that ankle bone becomes unstable, that's what causes the overpronation. So you can actually have overpronation without having a flat foot. And I think that's why there's so much misconceptions that are out there.
A lot of confusion. A lot of people
Yes.
probably think they're the same thing, right?
Right, exactly. Because pronation is a good thing. We need to have some pronation in our feet because that's when we're walking, it allows the foot to adapt to uneven weight-bearing surfaces. So pronation is good, but too much of anything is bad.
Okay, and if there's too much of something bad going on, does it cause sort of like a dislocation? Is that what's happening?
Yes, basically ankle bone dislocates over heel bone. And I still have my practice in Chicago. A lot of patients come to see me for other symptoms, and they don't realize it is caused by overpronation or that hind foot dislocation over heel bone.
There's sort of like an excessive motion going on in the ankle joint. Is that what's happening?
Exactly. And so what we can do is we see here on this film, which is a weight-bearing fluoroscopy, the normal amount of ankle bone motion. And there is a clear space called the sinus tarsi in between the ankle and heel bones. So that space should always be open. And now we can see on this other film, again, weight bearing, that how the ankle bone, it's sliding too much on the heel bone and that space is closing over abnormally.
So what can be done to fix this, if anything?
Well, again, this is the big misconception. So many parents bring their kids to the pediatrician and say, look, I'm concerned about my child's feet. They're flat, they're just not straight. And the pediatricians usually will say, and this is, in the literature and out there, and this is one of those myths that don't worry, they'll just outgrow it. But unfortunately, there's no evidence basis for that. And then as the years go on, it gets progressively worse.
And it gets worse, and it can actually affect the rest of their health, correct?
Yes, sometimes the whole family comes, grandparents, parents, and children, and then they have similar that genetic trait, and then almost like grandparents showing a lot of symptoms, and then I can almost foresee these children may develop into their parents and their grandparents' symptoms.
What does this mean for the rest of the body, though? Because obviously the feet are the foundation of your health, right? That's why you guys, in the sense of the atlas, being a foundation, a strong foundation.
Right.
How, if your feet are misaligned, sort of like a tire being flat, how does it affect the rest of your body?
Well, exactly, because the whole body rests on the ankle and heel bones. When the ankle bone turns inward excessively, well, that's going to make the knee twist inward, and so that's why people then have all these ACL injuries and the cartilage just wears away because we take thousands of steps every day. With the walking and everything, we're supposed to take up to 10,000 steps a day, and so this equates to millions of steps by the time you're even in your 20s. So by 40 years of age, the average person has taken 50, 60 million steps. So then that's why, you know, you reach that kind of golden age and all of a sudden your body starts falling apart. And you have hip pain, back pain, so.
Right. And you know, a lot of people don't know this, but my specialty is podiatry. So, you know, when it comes to fixing these things, we're talking about excessive surgery, fusing, cutting joints, and it's a heck of a, you know, basically healing time. But you guys said there's a better treatment option, a newer, innovative treatment option, correct?
Exactly. And so, yeah, and again, I practice the old-fashioned way of cutting the bones and fusing them, and it's just a big, complicated surgery, lots of risks and complications. So it's like, look, what they do for the arteries when they close, they put a little stent into there, and that opens the artery, and the blood's flowing through again. And so why can't we put a little stent into that little sinus tarsi space so that we still allow all of the normal motion, but we kind of take away the excessive motion? And so this is where we have this revolutionary device called HyperCure. And with that, we're able to put this into patients' feet just through a small incision. And they're able to run and jump and play and do all of the things that they always wanted to do beforehand. So it's really amazing.
I'm just kind of curious, Dr. Ahn, you're practicing in Chicago, very popular procedure. How are the insurance companies in regards to covering this?
So that's kind of tricky because nowadays insurance plans, you know, they have different reasons and excuses not to cover sometimes. And, you know, we're having some issues, but I always like to emphasize about what is the best treatment solution for patient, not really if insurance covers this or not. So big part of my mission is to educate patients about the best treatment solution.
And you said there's really no complications or real major risk factors with this procedure.
Exactly. So this implant's been on the market for over 12 years. There's been tens of thousands of them put into both children and adults. And the worst thing that we've ever seen is just that some patients, because they've been walking a certain way and now they're realigned, that they have adjustment issues. And so we can take the stent out and no harm is done. So it's really a win-win situation.
Coming up next, we're taking an in-depth look at heel pain. But first, some trivia. How many steps does the average person take in a day? Well, if you guessed A, 8,000 to 10,000 steps a day, you got it right.
Hello, I'm Dr. Anna Marie. Today we're discussing a problem that's known by many different names: runner's heel, plantar fasciitis, heel spurs. We're going to be taking a close-up look at chronic heel pain. This painful condition affects millions of people every year, and most of these folks are told that it could take up to a year or longer for their pain to go away. We're going to bring on leading foot and ankle specialist Dr. Michael E. Graham and Dr. TJ Ahn to get some expert advice on treating this heel pain. Doctors, thanks for joining me.
Our pleasure. It's great to be here.
Pleasure to be here.
So tell me about this heel pain. What's exactly going on? Is it because of trauma? What's the deal?
You know, basically it starts with the mechanics of the feet, and the plantar fascia is a big long ligament that goes from the heel to the ball of the foot, and it's there to basically support the arch of the foot. And so for people that have misaligned feet, this ligament is being overstretched thousands of times a day, and then eventually those fibers rupture, and then we end up with pain.
It sounds painful. It sounds painful. Doc, could you kind of explain the sense of what the plantar fascia's function really is?
Yes, so plantar fascia actually, if I may show in the foot model, it's actually on this part connects from heel bone to the arch and then forefoot. So when people don't know about this a lot, but a lot of times overpronation, which causes from ankle bone, dislocates like that, it kind of collapses the arch, but as this happens, the plantar fascia, which is in the bottom, that will be completely strained, and then we take, you know, thousands, tens of thousands of steps every day. This plantar fascia gets basically beaten up, and then they get diseased and they develop inflammation.
So what does it come to treatment options? I mean, I know we see, endless commercials, the kiosks in the mall, even in pharmacies, these arch that you can put into your shoes. What are your thoughts? Is it a solution?
Well, yeah, I mean, more than $250 million a year is spent treating heel pain. And when you look at the various websites and the information that's out there, they say, well, it's going to take at least a year or longer to treat. And, basically what ends up happening is that the fascia just finally ruptures. And so, which is the worst thing that you would want. I mean, the fascia is there to support your arch. So when that ruptures, then that's going to lead to other problems. Other tendons are going to be strained, and then that can lead to even other issues in your knees, hips, and back. The goal of treatment is to stop the overstretching. So when patients go in and get an injection in their heel, that kind of relieves the symptoms temporarily, but it doesn't address the underlying etiology of why they developed this problem in the first place.
I want to throw this out. I'm not sure if either one of you want to comment on this, but one of the hot buzzwords these days are stem cells. Are stem cells a solution?
Well, stem cells are a temporary solution, again, because it can provide healing to the tissue, but if you still have all of that excessive hindfoot motion, that overpronation, then we haven't, again, solved the underlying etiology, so it's going to be a temporary measure. And so what we want to do is fix things once and for all.
Sounds good. So what is the solution? What's the solution?
You want to show that hypercule bone
Yeah,
model?
well, so when we look at the whole overpronation problem, and this is what Dr. An was talking about, is that we have a naturally occurring space in between the ankle and heel bones called the sinus tarsi. So with overpronation, the ankle bone is sliding off of the heel bone, and then that's what leads to the excessive strain on their plantar fascia. So that's the problem with like foot orthotics. When you put something under the bottom of the foot, you still have that excessive motion occurring. So what we have is this revolutionary orthopedic stent that is inserted into the naturally occurring space. And so we still have all of the normal ankle bone motion, but it's stabilized now.
I don't want you to freak viewers out, but that's the actual size of the implant.
Yeah, exactly. So yeah, it's basically the size of your pinky. It's very, very small, and it's performed as just a minimally invasive procedure. So it takes about 15 minutes to put from the initial incision until the last stitch is placed.
What happens if the foot doesn't realign or get into if there's issues? Is it an issue taking it out, or?
Well, that's the great thing about this procedure is that even though it looks like we have these big threads on here, this doesn't screw into the bone at all. There's some soft tissues that are in this natural canal, and so those tissues grab a hold of the stent and anchor it and hold it into place.
Sounds great. And people are back on their feet pretty quickly, and it has no limitations. You could do whatever, run, jump, do whatever you want, right?
Exactly. Yeah. I mean, once the tissues are finally healed, yeah, we have all kinds of athletes that have had this into their feet, and they're performing at a better level because
I understand
of
there's a professional athlete, a tennis star, but we can't mention their name.
that. No, exactly. I know. With waivers, so.
I know in the sense of insurance companies, is it something that they are kind of more and more kind of helping out in regards to covering costs? Or?
Yeah, unfortunately, the insurance industries, they, just because of the rising costs of coverage of various things, they have questionable coverage with this procedure. So what Dr. An and I have done is we've founded Atlas Foot Alignment Institutes, which is where patients can go when the insurance doesn't cover it. And so this way, this is something that can be done as an in-office procedure. And these centers offer affordable treatments for their patients.
Well, if folks want to learn more or find a doctor or specialist in the area, where should they go? Good website?
Yeah, absolutely. atlasfai.com.
When we come back, we're taking a close look at an innovative solution to bunions. But first, we have some trivia. How many people are estimated to have misaligned feet? Well, if you guessed A, 45%, you are correct.
Hi, I'm Dr. Anne Marie, and thanks for joining us. We're fortunate to have world-renowned foot surgeons Dr. Michael E. Graham and Dr. T.J. An in the studio. Doctors, thanks for being here.
My pleasure.
Honored to be here.
So before we start, bunions, what are they?
So bunions are enlarged big toe joint. So when they get enlarged, sometimes it irritates by the shoes or the way they walk.
Why are some folks basically cursed to develop these?
Yeah, it's really it's a hereditary thing that you're either going to have it or you're not, and they progressively get worse over time. So.
Why?
Yeah.
Why do they progressively get worse? Is there an underlying reason?
There has to be an underlying reason, exactly. And so, walking is one of the most common conscious functions of our body. It's actually number 2 next to breathing. And so with every step that we take, there's actually a slight misalignment at the big toe joint that begins in the hind foot.
So what does that mean in the sense of, for our viewers, in the sense of the hind foot mobility, I should say, excessive mobility?
Exactly. So there's really a pathologic condition, meaning it's not normal, where the ankle bone loses its normal alignment and stability on the heel bone. And in orthopedics, we have this saying, it says that the hind foot controls the forefoot. So because of that excessive hind foot motion, then that puts a lot of strain on the big toe joint, and then the body reacts to that strain by forming spurs and thickening of the tissues, like Dr. Ahn was saying.
A lot of people have bunion surgery, corrective surgery, and afterwards they either complain of pain. In some cases, the bunion comes back.
Exactly. There's been over 100 surgical procedures to try to fix bunions, and the leading complication of all of those is recurrence. So what that tells us is that the surgeon did perform a great job of realigning the bones and everything, but something was missed. There's a missing link to the treatment.
And that link is in the back and the heel.
Exactly.
We have these great models here. Do you want to demonstrate in the sense of this new procedure and basically how the hind foot controls the forefoot and what your solution was?
Sure, exactly. Well, let's first cut to the video that we can see here is an aligned ankle bone. So what we're looking at is a weight-bearing x-ray of somebody who's standing, and we see here's the ankle bone, here's the heel bone, and in between those two spaces, we have a naturally occurring space called the sinus tarsi. And now here's another patient that has a misaligned ankle bone, and you can see how the ankle bone is moving excessively and how that little space is closing. And then we can now take a look at the forefoot, and we see that here's the first metatarsal bone, and then when the hind foot kind of is misaligned, the metatarsal bone is jamming into the base of the big toe joint.
In my practice, when patient presents for bunion, and then when they stand up with full weight bearing, their bunion actually seems to get worse, and they don't know why, but usually because that hind foot misalignment causes more pressure to the big toe joint, and it makes bunion actually a lot worse than it is. So when we correct rear foot misalignment, surprisingly, a lot of times mild to moderate bunion kind of corrects itself.
It's kind of like the hind foot's connected to the forefoot, right?
Absolutely.
What are your thoughts about
Exactly.
orthotics? Because, in the sense of fixing bunions.
Well, again, this is one of those other big myths. And, orthotic industry is a billion-dollar industry. It's unregulated. And so many people recommend, so many doctors and everybody recommends the use of orthotics to slow or prevent your bunion from occurring. But the reality is very different. There's not a single published paper that shows that an orthotic reverses or slows bunion formation. Actually, there's 2 papers that shows how patients' bunions progressively got worse. And that's because orthotics don't realign and stabilize the ankle bone.
Sounds good. But you do recommend maybe possibly even after the procedure, maybe having orthotics as an...
Sure, exactly. So how the best way to fix this is that we have this space that's closing abnormally in between the hind foot bones, and so we want to put a little stent into there, and so we have
it right here, right?
Yeah, exactly. So we have this little titanium round little spacer that is inserted into that little space just through a small incision, and instantly the ankle bone is realigned and stabilized. And as Dr. Ahn was saying, when patients are standing, it decreases the force on their big toe joint, and so we have many cases where the bunion actually reversed itself, or at least it didn't get progressively worse.
20-minute procedure, minimally invasive. People are back on their feet in a week or 2.
Yep.
Sounds too good to be true, but how exciting. If folks want more information or find a doctor in their area that performed the procedure, is there a good website they could go to?
Absolutely. We have atlasfai.com. We have a whole network of surgeons throughout the country that have this available for their patients.
That's awesome. Doctors, thank you so much for being here. Great information.
Thank you.